Ontario nurses tell us their new contract will make hospitals more dangerous for both nurses and patients after their desperate plea for minimum staffing ratios was denied. The Ontario Nurses Association says it sends a clear message that nurses do not deserve the same safety and numbers as other frontline workers.
Absolutely horrid. It further reinforces that our bodies are expendable, that the dangers that we face in nursing are acceptable.
Despite being legislated in other provinces, mandatory 1-to-4 nurse-to-patient staffing ratios will not become a reality in Ontario for the 60,000 nurses represented by the Ontario Nurses Association after an arbitrator denied their request.
Nursing is probably the most dangerous job statistically in Ontario, and there's no help coming. There's nothing for us.
Disappointment and betrayal. It's just failed attempt after attempt.
Registered nurse Aram Chagala spoke with us after finishing her hospital shift.
It ultimately impacts, unsafe care for patients and families. I just feel like we're never going to get there.
She tells us she is forced to sometimes look after up to 10 patients at a time.
Would you say this happens on a daily basis?
Yes, absolutely. It's very challenging. It's very taxing. There's a moment where you need to just sit and breathe, but sometimes that's even difficult.
But the Ontario Hospital Association has called fixed staffing ratios a rigid model that could result in some units being understaffed while others are overstaffed. Opposition critics say the only way to make it work is to address the nursing shortage in the province.
Unfortunately, the health minister is not listening, nor are they actually doing anything to attract that talent.
A spokesperson for the Minister of Health tells us they've registered a record number of new nurses, adding a total of 50,000 new nurses, with another 30,000 studying nursing. Despite that, there are currently 16,000 nurses registered but not practicing in Ontario.
How are we going to draw other nurses into the system that are already trained? And then we can actually implement nurse-patient ratios.
While the new ONA contract also comes with a 5.25% pay increase over 2 years, their president tells us their message to the premier is that their safety should be top of mind.
He shouldn't be pouring out bottles of liquor. He should be pouring out legislation that protects nurses.
The union says they are demoralized, but they will be fighting the decision and looking at ways to pursue job action. For City News, I'm Tina Yazdani.